everyone. Welcome to the convocation of our graduating 22 class. Again, a friendly reminder to have your mask on fully, covering your nose and mouth. At this time, we would ask everybody to have a seat and to welcome the graduates.
Hello everyone, it is an honor to welcome you to this celebration.
For the last several months, our committee has worked hard to make this event special and memorable for everyone.
This 2-year journey has not been easy, but we all made it.
So please give it up for our MPH cohort of 2022. And now our culture greetings.
In Vietnamese. Xin kính thưa quý vị khán giả, các thầy cô, các bậc phụ huynh, các bạn bè. Xin cảm ơn mọi người đã đến dự lễ tốt nghiệp của chúng con hôm nay. Thank you.
In Tagalog, mabuhay, malugod na pagpupugay sa mga nakapagtapos, kaguruan, kapamilya at mga kaibigan. Maraming salamat po sa iyong pagdalo sa kaganapang ito. Thank you.
In Punjabi, Sat Sri Akal ji, मैं आज सारे परिवाਰਾਂ ਦੋਸਤਾਂ graduates ਅਤੇ faculty ਦਾ ਸਵਾਗਤ ਕਰਦੀ ਹਾਂ ਸਾਡੇ ਜਸ਼ਨ ਵਿੱਚ ਸ਼ਾਮਲ ਹੋਣ ਲਈ ਤੁਹਾਡਾ ਸਵਾਗਤ
In Ethiopian, ተመራቂዎች ቤተሰብ ጓደኞች ስለመጣችሁ እናመሰግናለን የደስታችን ተካፋይ ስለምትሆኑ እናመሰግናለን
In Spanish, bienvenidos graduados, facultad, familia y amigos, gracias por venir a nuestra celebración. Gracias.
My name is Dr. Andrew Carter. I'm an assistant professor and coordinator of the MPH online program. It is with great honor that I introduce our faculty, staff, and chair. Dr. Monica Allen. Dr. Rachel Berkowitz. Dr. Angie Buckner. Dr. Vicky Gomez. Dr. Robert Rink. Dr. Amy Sapp. And Holly Hunt, and Yana Ruho Nubayorova. Now, Dr. Monica Allen, Professor and Chair of the Department of Public Health and Recreation and the College of Health and Human Sciences at San Jose State University, would like to share some words. So please welcome Dr. Allen to the stage.
Thank you, Dr. Carter. And thank you, MPH faculty, our honored guest and speaker, Rhonda McClinton Brown, an alumna of our program. I'm pleased and so proud to be here with you at my very first convocation as chair. And to you, partners, spouses, children, parents, extended family, friends, neighbors, and community members of our graduates, a special thank you Without your love and support, they would not be here today. These past 2 years have been intense and challenging, and without you, they might not have been able to do it. Your hot meals, your patience when they were busy, your tolerance of their bad moods, generosity when they used more than their allotted share of the bandwidth, and their listening ears and good advice when they wanted to vent are all appreciated. You're a very important part of this day, and I want to make sure you get the acknowledgement that you deserve. And to the graduates, 2 years ago this week, you were a wide-eyed group of incoming MPH students. The theme of the week was nervous and excited. We always ask you, what 2 words do you think about? And you were nervous and excited. You entered the program under circumstances that none of us could imagine. The world was turned upside down, and you were participants in our first ever virtual campus week. As your first instructor, as a matter of fact, we had 2 classes together in your first semester. I hope you didn't get tired of me as I worked to help you understand the foundations of public health, help you get adjusted to a graduate program, some of you again to a graduate program, and to help you build the community that's needed to be successful in this program. And as I stand before you on this, your last day in the program, I know that all those things happened and so much more. I've observed you, albeit from a bit of a distance, effectively communicating and advocating for the things you thought were correct. I saw you on Monday in particular take time to guide and support a group of wide-eyed new MPH students, even as you were on your way to your very last class session. I know that you are ready to take on the challenges of doing what we do in public health, and that is changing the world. At this time of transition, yours, mine, and in the department, I can't help but think about the fact that there is great change happening in our society, and it doesn't all seem to be in the right direction. And the recent overturn of Roe versus Wade by our Supreme Court has significant immediate and long-term impacts on the health of women, girls, and everyone in this country who has the ability to get pregnant. What's worse, we received a clear signal that this is only the beginning. In the communication that came with the decision, Justice Thomas suggested that the Supreme Court may reconsider previous decisions related to contraception and rights of the LGBTQ+ community. On the heels of Supreme Court decisions that impact public health, horrific scenes of gun violence, racial unrest prompted by hate crimes directed toward specific communities, a pandemic that's overwhelmingly impacting some populations disproportionately, and the visible results of climate change, it's apparent that our work is more important than ever. At its core, public health is about social change. It's our mandate to work to create an equitable and just society. And while it may seem daunting, I want you to remember what you bring to this work. You can collect, analyze, and share in multiple formats the data required to assess a community's needs and assets. You can apply the appropriate theories and frameworks to programs that will be effective at the individual, interpersonal, community, organizational, and policy levels as best suit the needs of the population. You can organize and lead a group to make effective change in communities and organizations. You can develop and implement plans for purposes of training, programming, or to evaluate the impact of your work. You can communicate effectively with multiple populations while acknowledging your privilege, your own culture, and how both impact the way you move through the world. And more importantly, you've just proved that you can write an entire program plan in 16 to 24 hours while a rotating cast of total strangers peers at you through your webcam. After that, the world can just bring it on. You can manage anything. And as you react and respond to these global and national crises, there are positives as well. We celebrate and welcome a new justice, Ketanji Brown Jackson, the first Black woman to serve on the Supreme Court. And you enter a world that is prepared for you in a way that it hasn't been before. As everyone spent 2 years in their homes figuring out the best mask and what exactly is 6 feet, they saw in real time how different populations are impacted by illness, violence, and changes in our climate. Dr. Sarah Cody and Dr. Anthony Fauci have made what we do more understandable and accessible to the general public. Public health programs have seen a record number of applicants, so you will soon have much more help in this fight against inequity and disparities. And as you start or continue this fight, I want you to remember the last thing that you take with you, a final gift from the SJSU MPH program. It's all of our congratulations for your accomplishments, all of our pride in your achievements, and all of our well wishes for your future. It's been our pleasure and our honor to have had you in the MPH program at SJSU. We're so pleased to have been a part of your journey. And I want to remind you that your journey with us is not over. As an alum, you are a permanent part of the MPH community. We'll miss you as our students, but we welcome you as colleagues. And we look forward to supporting you and celebrating with you in the future. Congratulations again, and be well. And now, please welcome Jasmine Betka, our student speaker, to the podium.
Glasses change. Hello, faculty, staff, graduates, family, friends, and loved ones. It's an honor to be here today with all of you in person and virtually. When I first found out that I was going to be the student speaker, I was so honored, and then I was so nervous to represent some of the most amazing people I have ever met in front of many of the people who mean the most to them. But then I just started thinking about the people who I would be representing today, and the people I would be standing up in front of. This may be the first time many of us have met in person, but this cohort has been a part of each other's lives for 2 years, and we've gotten to know so much about not only each other, but about each other's lives outside of this program. Over the past 2 years, we've seen loved ones sneak dinner into class, and sometimes that dinner takes the form of wine, but no judgment here. We've had group Zoom calls from various places, including after a birthday dinner in a car, and we end up talking about where not to camp with spouses. We've watched kids grow up and even go from a baby to walking and talking. We've heard about major life moves and career changes, about missing family gatherings because we have to write a paper. We've seen pictures of each other's family as we shared what our culture means to us and who we are. And we've even heard about some people's darkest moments of loss. And so in thinking about all of this, I was reminded of how much love and joy, pride, happiness, and friendship there is here today. And for some reason, in thinking about the relationships all of us have formed, and the friendships really, I thought of this little book that a friend gave me years ago. It was called Friends Love You, Warts and All, and it had a little toad on the front. And in that book, my favorite quote was, "A friend is someone who helps you up when you're down, and if they can't, they lay down beside you." Sweet quote, right? But then I started thinking about who my classmates are and what we've learned over the past 2 years. And no offense to unknown author, because it is a great quote, but I don't think many of us would be satisfied with the answer of helping people up when they're down and laying down beside them if not. Because in public health, we would want to know what knocked them down in the first place and why they cannot get up. And in thinking of this quest to know about what knocks people down in the first place, I was reminded of one of our first classes with Dr. Allen. Dr. Allen was teaching us one of the most critical concepts of public health, the fact that there are downstream interventions and upstream interventions. And I promise I won't take too long to summarize this massive lesson, because I know many of you probably feel like you also have gone through this program. I know in my house we've had some light dinner conversations on social determinants of health. But the basic imagery or analogy associated with this concept is picturing a stream or a river. And at the bottom, there's a bunch of people who have fallen in and are drowning. So you keep pulling the people out and trying to save them. But more people keep falling in. And as important as saving lives is in doing this type of trauma care, in public health, the goal is to move upstream, to go up the river and find out what's causing people to fall in the first place, and to prevent them from ever falling in. And this is public health. Public health is looking at populations and seeing how we can keep them safe and healthy and prevent illness. And for us as students, the thing about learning about these upstream changes is that all of us started this journey with different tools and resources available to us. For some, maybe they're the first in their family to attend higher education, and so they feel like they're navigating this academic world alone. For others, maybe academics has never been a welcoming place, but a reminder of not fitting in, of not being the mold or checking that box. Or maybe our academic skills are a bit rusty because we haven't been in school in a few years or decades. Perhaps we started this program unsure if we had the financial, physical, psychological support systems we needed to succeed. And all of these factors and more cause some of us to sometimes fall in to the various currents that we are trying to prevent others from falling into, and we ourselves end up downstream. And we get bruised, and we get pulled out, and then we take ourselves back upstream. We become more resilient. We keep working to fight for systemic inequities. But the reason this upstream, downstream concept is so important is because it involves all of us. You are the co-creators of our work in public health. It's through your stories and experiences that we learn about people and communities. You cause us to reflect on our positionality and beliefs and to enter communities with humility. Your histories lets us recognize who we open and close access to, if an accent or the color of your skin or the place you were born makes you face additional barriers to well-being. Your heritage allows us to reckon with the fact that we are on Muikma-Ohlone land today and what that means. Your experiences allow us to question labor laws and what it means to be essential, and to make sure people are safe at work, whether that's having proper access to masks and protective equipment, or proper protection against pesticides and hazardous chemicals, or to question why you can be 12 years old and work in agriculture with little to no protection. Your pain makes us challenge why people get sick. When someone gets cancer, we want to know if it was caused by an environmental condition or stressor, worsened by access, impacted by social norms, or hindered by systemic barriers like pharmaceutical costs. Your health makes us look at heart disease, diabetes, hypertension, and other chronic illnesses as more than personal decisions, but symptoms of complex physiological, social, environmental, and psychological stressors. Your fights make us fight harder to be sure that people are free to love who they want to love, marry who they want, and to be who they want to be. And what that looks like in policy, in schools, in communities, and in laws. And to challenge who has autonomy and rights over their body. Your struggles with COVID-19 make us look at the U.S. workforce, childcare, gender norms, who has access to health care, paid time off, how vaccinations are distributed, how messaging is being received, or even if the color of your skin impacts the ability for a medical device to properly read your blood oxygen levels. Your passion makes us think about our shared world and how we can better our environment and reduce environmental burdens on disproportionately impacted communities. Your stories of loss make us rethink healthcare and how we can enhance access to preventative care, incorporate multiple perspectives on how we achieve health, and how we can bring culture into healing and care to increase well-being throughout life. Your lived experiences make us wonder why someone can be working to make people healthy without having access to healthcare themselves. And because of all of these experiences that you share with us together, we get to work on moving upstream, on asking who wrote the rules in the first place, on finding ways to liberate people from structural barriers and mobilize community assets for change. And all of this is public health, because public health really is in all policies and in everyone's story. And this degree gives us the power to do more for our communities. And our faculty has spent 2 years preparing us to do this work. They've taught us how to collect and analyze data and also to spot biases. They've taught us how to develop health promotion program plans past the individual level that looks at changing those upstream factors, and how to organize with communities instead of doing things to communities. They've also made sure we're really well versed in group work. But to all of us here graduating and ready to change the world, to go upstream and prevent people from falling in the first place, the work's hard. And so often the passion that once ignited us feels like it starts to burn out. We get tired of being resilient. We get tired of having to fan our own flames of passion. And when that happens, I want to remind you that there are people who understand, who believe in the work that you are doing, and who want to support you. Call us, reach out to faculty, find the people who believe in your message and believe in you. Don't let this be a 2-year shared journey that ends today, but rather an introduction and training for the work we can do together. So to all my peers and their loved ones, for all the family dinners we missed and times we didn't do our laundry for a while or locked ourselves in a room for an entire weekend, know that it is because we are working to make sure that when people get knocked down, that when communities are pushed down, we find out why and we work to make sure it doesn't happen again. Thank you all and congratulations. We're so lucky to have you all in the field. Next up is our Convocation keynote speaker, Rhonda McClinton Brown. Rhonda McClinton Brown has more than 25 years of experience in the field of community health and is currently the director of the Health Communities branch of the Santa Clara County Public Health Communities Program and maintains current data to assess the health of the population. Before working at the County Public Health Department, she spent 12 years as the Executive Director for Community Health Partnership, where she advocated for affordable and accessible health services for the diverse and multicultural communities of Santa Clara and San Mateo counties. Afterwards, she transitioned into Stanford School of Medicine as Executive Director of their Office of Community Health. In 2012, Rhonda received the Inspiring Change Leadership Award for her exceptional commitment and ability in enhancing the health and well-being of her local communities. Rhonda is also a graduate of the SJSU MPH campus program. We are grateful to have her here to share some words of wisdom and encouragement. Without further ado, I'd like to welcome Rhonda to the stage.
Thank you so much for that warm welcome. Oh my goodness. Hello, everyone. Good afternoon. I am so excited to be here. And let me just say, after these 2 words, I feel like I can just say, congratulations. Now we can go home and we can go to the next phase. I don't think I have anything else to say that hasn't been said already. That was just beautiful. And Dr. Ellen, your words were inspiring and so beautiful as well. And I'm going to piggyback on a couple of things that you said as well. And maybe I'll skip my upstream, downstream parable story that I was going to say. So thank you again for inviting me to join you on this joyous occasion. I am honored to spend a few moments with you today to help celebrate you as we bring closure to your MPH academic career and begin imagining or reimagining where your next career journey will take you. What I really appreciate and love about San Jose State University is the wealth and diversity of students who choose this institution to advance their careers in public health. The professional lived experience students can bring to their academic learning makes this environment a wealth of academic knowledge. As an alumni, should I take my mask off? Can you hear me better? Sorry about that. As an alumnus of this program in this university, I want to share that the friendships, the collegial relationships, the mentors that you will gain here can and will become your lifetime network in your career and other fantastic opportunities you have before you. The friendships and network that I created when I was a student here, I still have today. Even today, I reached out to a colleague that I went to school with here that was, gave me a baby shower when I was having a baby, to really review a report that we're doing on the cost of gun violence because I wanted her eyes and her lens on it. The relationships that you establish here today will be your colleagues, your friends, your partners, your thought thinkers around strategies, your connectors, and it's just a wealth. It's such a great opportunity. When I was here, I had no idea the strength and the magnitude that this opportunity, having this network, would bring me in my career. And decades later, I'm still here receiving the benefits of the strength of this academic institution. So I just wanted to share that with you. Today, I want to spend a little time talking about the future state of public health, kind of where we've been, some challenges we've had, and why I think it's so exciting that you're at a place where you're really thinking about your career and your journey as you graduate from with your MPH. But I want to start with where we've been and talk a little bit about traditional public health role, kind of the traditional public health that introduced me to public health early in my career and why I chose to advance my career in public health. When we think about public health in its empirical way, we think about prevention of disease and injury, we think of promotion of healthy lifestyles, we think of creating healthy environments. Right? You talked about so much more than that today. We talk about advocacy for policy and systems change. We know public health is proactive. We know public health is about prevention. We know that traditional public health has really focused on the health of entire populations before people get sick, rather than focusing on individual behaviors and individual consequences after people become ill. We know that. In my career, I started public health in the 90s as a health educator at Indian Health Center, which is a community health center here in the city of San Jose. During those times, there was a philosophy that if we just taught people how to be healthy, then everything else will follow. If we just gave them the skills about how to eat right, if we just told them, take a walk every day, everything would be okay. If we just provided moms with car seats, all kids would be safe. If we just provided smoking cessation, there would be no challenges related to smoking. Everyone will stop smoking. No, we didn't think about, what about preventing smoking in the first place? What about targeting specific populations around smoking? And I learned later, my father went to college on a scholarship from the tobacco industry that paid him to pass cigarettes out to his college friends so that they would begin smoking menthol, of course, because it burns and then you can get addicted quicker. Who would have thought that the disproportionate targeting of African ancestry people around smoking would lead to decades later of a disproportionate impact that we have with lung cancer and other related issues related to smoking. But when I started in public health, it was all about, well, let's just allow people to quit smoking. I didn't have that foundational learning that you have right now. But also during this time, we had policy changes. We did have car seat laws. We did have no selling of cigarettes in vending machines. We began to listen to people about barriers to becoming healthy. We began to learn those things. I realized that I needed to have more education and a stronger foundation on the theories and around public health. So I decided to return to San Jose State and to get my master's in public health so that I could better understand and ground myself in the theories and models of public health and begin to learn about the why. It's the why. It's the why that you were talking about today. It's the why that allows us to move upstream, and it's the why that's allowed us to broaden and deepen the role and impact of public health in the community. And through this, I saw many victories in public health and could apply my newfound knowledge I gained in my public health career. The field did experience victories in the 90s and so on. There was many breakthroughs in infectious disease, many advancements in vaccines, infant and child safety, significant progress in tobacco and smoking, fluoridation of water, universal reproductive health services, which is being unraveled right now, better seatbelt laws, and evolution of community health centers, which was my foundational learning early in my career. A critical point in the public health history. So what was missing? The critical barrier related to improving public health is equity. The true mission of public health, Dr. Allen talked about, is change. Largely depends on factors not associated by health, like high quality education that you were talking about, income, wealth, social structures. There is so much more to risk than the choices of public health. I am going to skip my little upstream, downstream parable that I was going to break it down now of why we're transforming and deepening the new way in our deepening role in public health. But I will say this, the public health workforce is aging. Some people are burnt out. And in your upstream, downstream parable, there's many of us that are stuck downstream. COVID really pushed us downstream. The pandemic really moved the public health department in our government systems from a place of working centered in equity, from a place of thinking about upstream, from a place of really being able to intentionally focus on upstream strategies to way looking downstream. And because of that, I think we have a workforce in public health that is tired, a workforce in public health that's burnt out, a workforce in public health that's aging. And it really is an opportunity for us to think about the transformation forces to move us back to prevention. That is one thing that I want to focus on today. I want to stop for a second and share, and this is where you come in. I want to stop and share a passage from a book called Across That Bridge, A Vision for the Future of America by John Lewis. And I'm going to say a passage now, and I'll end with a saying in a few minutes. John Lewis says, "Take a long, hard look down the road you have to travel. Once you have committed to work for change, know that this transformation will not happen right away. Change often takes time. It rarely happens all at once. We didn't know how history would play itself out in the movement. Use the words of movement to pace yourself." You talked about being resilient. We used to say that ours is not struggle of one day, 1 week, or 1 year. Ours is not the struggle of one judicial appointment or presidential term. Ours is the struggle of a lifetime, or maybe even many lifetimes. And each one of us will in every generation must do our part. And if we believe in the change we seek, then it is easy to commit to doing all we can, because the responsibility is ours alone to build a better society and a more peaceful world. This, to me, is public health. I love the ending part of this. I think it resonates with me and how I have oriented my career. And I think what keeps me resilient, although I have moments of fatigue, I have moments of anger, I have moments of being frustrated, it keeps me motivated because I keep going back to these words that I'm hearing here. There are many roles and many parts of this transformation journey in public health that is before us. And there is a place for each and every one of you. I really want you to hear that. There is a place in public health for each and every one of you. In my career, I've had the privilege of working in different environments. I started my career in community health centers. I transitioned to nonprofit organizations. I had a long stint in academia, which I also enjoyed. And now I've had the privilege and opportunity of joining the County of Santa Clara Public Health Department. My comments here that I'm going to talk about really focus on the public sector, the government sector, where so much change and transformation is happening right now. I do not view, though, the government public health sector as the leader in public health. By no means. By no means. Instead, I look at public health as a facilitator, a convener, an active participant dedicated to justice and equity. Some of the comments that I heard Dr. Allen say today. So I want to take a minute and define a few key areas in public health moving forward that we really want to need to expand and grow our diversity and our workforce to help us move forward. Because we have moved downstream the last years because of COVID, we have also had to take a step back. And this is a really prime and critical and urgent opportunity for us to both step forward and both move up. And we can't do that without you and without others to be a part of the process. So there's 5 things I'm going to say. Integration of racial and health equity in all forms of public health practice, including authentic community engagement and trusted partnerships. 2, ensuring a diverse workforce with lived experiences and skills to work at a grassroots level. 3, being able to lead with data and technology and really thinking about how those tools and expertise in those areas can help advance our work towards justice. Advancing in policy and advocacy, and continuous learning and workforce development. So integrating racial and health equity in all forms of public health, you so eloquently talked about that today. We must integrate a racial and health equity framework that assumes that regardless of people's living conditions, their social status, their race, their immigration, their gender, sexual orientation, that all people should have a fundamental right to be healthy. And I have lots of examples about that, but I'm not going to talk about it because you did it so well. What I will do is share an example related to COVID and racial and health equity. The pandemic was the most significant public health crisis of the century. Why was the pandemic so difficult? Why was it so difficult? Perhaps decades and decades of underinvestment in public health did not allow us to prepare for a novel virus such as COVID. We could not bear the overwhelming impact of COVID. It took the entire county workforce, additional paid and volunteer staff to address the needs of COVID. It also required deep partnerships with healthcare delivery systems, academic institutions, community-based organizations, grassroots groups, resident leaders, and businesses. Perhaps the extreme polar divide in this country and the level of hatred left our public health officials and the recipients of hatred and violence. There has been no time, I shouldn't say there's been no time. I am continuously in awe about how divided our country continues to be. And sitting in our public health space, it's just incredible that our decisions that are being made that impact our humanity and the human lives of individuals. In addition to the reproductive health example that Dr. Allen gave, we also had a recent judgment by the Supreme Court related to New York and gun violence, which has pretty much eliminated our ability to advance policies that's going to improve protections for us for gun violence. Very difficult times. Maybe the novelty and lack of evidence of strategies to eradicate the public health threat of COVID was difficult to us already. But however the difficulties were in COVID, there was 2 things that were fundamentally really turned the trajectory of COVID. One, of course, is obvious, the development of the vaccine, right? So having the development of the vaccine was the one greatest part that really turned around the trajectory. But the second thing was really beginning to focus our efforts on equity. And once we were able to focus our efforts on equity, we were able to provide housing for people who didn't have the ability to isolate. We were able to support essential workers who were at significant risk of infection. We were able to develop ethnically specific educational campaigns, such as COVID-19 Black. We were able to establish vaccine clinics, not just the mass ones at Levi Stadium for everybody, but ones for specific unique locations at community health centers, at churches, at parks, at workplaces for essential workers, where people felt comfortable and where they knew people were living. That's just one example. I'm going to move to lived experiences and skills to work as a grassroots level. Public health now requires and needs a diverse workforce with lived experience and skills in working with communities on community-led grassroots efforts, addressing neighborhood conditions to improve those things that are good for us and eliminating those things that are targeting us or disproportionately impacting us and that are not good is a significant change we must commit to achieving justice. For the COVID-19 pandemic, we were able to open up 2 resiliency hubs, one in San Isidro Park in Gilroy, and one at our offices at 1775 Story Road next to Cardenas Market. We were able to partner deeply with the residents in the community in that area to develop these hubs based on what they saw was the best solution for their community. Each of these hubs are actually run by residents who live in the neighborhoods in that area. And through those hubs, we do COVID education and outreach, we do testing, we do resource development, resources support. But we also are doing other things that the community has identified as important. So we're working on climate issues related to indoor air quality. We're doing heat and cooling rooms. We're working on food security. In San Isidro Park, we're also working on youth activities and youth development. So we really focused on what the community needed and what the community wanted. We were also able to raise significant dollars because the community said that they were at risk because risk of displacement because of the pandemic. So we were able to raise dollars and get those dollars out to the community very quickly so that people could pay their rent, they could get food, they could get their basic needs met. Another example around data and technology. Understanding disparities and the disproportionate impact of health outcomes through an epidemiological approach is critical to identify where to focus resources, where to focus efforts, and where to focus strategies. Public health professionals who embrace quantitative and also qualitative research to understand the root causes of unequal outcomes are equally important. During the pandemic, we utilized mapping and case data to identify areas to focus door-to-door educational strategies. Our community partners wanted to go door-to-door in their neighborhoods, and so we utilized data to help them navigate the way to go. Population-level data is also important. We are just completing a cost of gun violence study in the county of Santa Clara. The Board of Supervisors, after the Gilroy mass shooting, wanted us to help them understand the magnitude of gun violence in Santa Clara County and the cost that gun violence incurs. And with that, we decided that we would also engage the community to do a series of stakeholder meetings so that they could help inform the recommendations we made to the board. This study was very difficult because the data related to violence and gun violence was very hard to find. We have systems that don't talk to each other. We have communities that have experiences in their own set of data that we didn't necessarily have access to. So really having a public health workforce that really is able to really think about data, to really develop these data sharing systems, to really be able to create an environment where we have population level data that helps us really understand the magnitude of the problem, but also helps us work collectively to identify the solutions. Gun violence is so complex. There are disproportionate impacts across different ethnic populations. There is intended and there's unintended. There is suicide and there is assault. There is police involved. There is many forms of gun violence. And without data, it's really hard to understand which strategy should we be working on first. Two more and then I'll close. Another critical role for you all as public health professionals is the role of policy. Public health professionals who help shape policy to support positive outcomes can have a profound change in health. For COVID, as an example, again, this was working to institute anti-displacement policies. You know, everyone didn't have the opportunity to take sick leave because they had COVID. And so the economic impact of COVID was significant and severe. We were able to shape policy around safe schools practices and shape policies for essential workers in their workplace. Another non-COVID example is Children's Bill of Rights, which is a new initiative that we have in the Public Health Department. It's a community-led initiative that really speaks to a policy agenda around outdoor experiences that all children should have. It seems logical that all children would have outdoor experiences, but that's not true. This Bill of Rights really culminates a set of recommendations that we will use as our policy agenda. Things such as having clean water, having a place to swim, being able to camp, being able to garden, being able to walk, have sports, have exposure to animals. These are things that we have decided that all children, based on our community voices, that all children need. And the Public Health Department will work collaboratively in the community to help advance these as a policy agenda. So we need a workforce who really is excited about policy to help us do those things. The last one I want to talk about is workforce development. You're at the end of your journey now with your MPH, but we are lifelong learners and need support to continue our journey of learning new frameworks, new philosophies, self-reflection and self-efficacy, ways to rejuvenate ourselves and recover when times are hard, and to learn new evidence-based practices. There is a role for public health professionals to continue to create a learning environment or a community of practice so that we can always utilize our best professional skills in building the evidence within the science of public health. In closing, the transformation and changing of public health movement is very exciting. There are unique places for us all. We all have a role. Our collective work is critical, but our individual journey is an essential and integral part of the process. Embrace it. Share what you learn about yourself and your journey. Public health needs you. We want you, and we look forward to being an active collaborator with you. We applaud San Jose State University for your outstanding role in advancing the field of public health and the inspiring future in public health as public health professionals. I want to end with another passage from John Lewis. He says, "The 50 years I have spent working toward building of a better world is that the true work of social transformation starts within. It begins inside your own heart and mind, and because the battleground of human transformation is easy, more than any other thing, the struggle within the human consciousness to believe and accept what it is true. Thus, to truly revolutionize our society, we must first revolutionize ourselves. We must be the change we seek if we are to be effectively demand transformation from others. It is clear that the pot is being stirred and people are beginning to breathe in the essence of change, and that will lead the soil to act. Who will emerge at the forefront of this struggle in the 21st century? Perhaps it'll be you. I am honored to be here today. I enjoyed my time here as a student in public health. I've had a really wonderful, diverse, and ever-changing career in public health. The limit is infinity. You have many options. I am so excited to be here with you. I want to congratulate you. I want to thank you for having me join you today. And I'm just looking forward to hearing more about your journey. Best wishes.
Thank you so much, Rhonda, for your inspiring words today. Now is the time that you have all been waiting for. We are going to be calling the graduates to the stage so Dr. Andrew Carter can hood them. So will the first line of students please stand? And may I also call Dr. Amy Sapp and Dr. Rink to come to assist me in the elbowing of students, congratulatory elbowing. We're going to let the students get together. All right. The first student that I would like to call is Allison Alardisi. Stephanie Jill Argast. Stephanie Ariola Ruiz. Jasmine Becca. Aknor Tower Burke. Gino Carvalho. Hung Duong. Ia Gardner. Sara Gutierrez. Alondra Hernández Flores. Viridiana Herrera. Sarah Dorothy Hoffman. Audrey Cortez Kodama. Mirna Lopez. David McCune. Dulce Candelaria Mendoza Garcia. Carolyn Vu Nguyen. Giovanna Lopez Nuevo. Bhavna Ravi. Kathy Reyes Beltran. Bruktawit Buldameriam. Anita Diane Wong. Kathleen Wako Yumul. We would also like to honor the students who could not be here with us today. Elizabeth Lizzie Elsie Moore and Kyle, yes, and Kyle Lane McKinley. Congratulations to our graduating class of 2022. Next, I would like to have Dr. Carter present the MPH Awards along with Yana.
Each year, the MPH faculty goes through the process of determining the awards for the graduating class. The faculty collect data on how students did in their analytical and writing courses, and then the MPH faculty come together to finalize the remaining results, the remaining awards. It is our honor to present the awards for the 2022 MPH Online Program graduating class. Please come to the podium and receive your award. The Outstanding Analyst Award is awarded to students who received a 95% or greater in both quantitative methods courses and the evaluation course. The recipients of the Outstanding Analyst Award are Allison Allardyce, Jasmine Betka, Gino Carvalho, Hung Duong, Alondra Hernandez, David McCune, Kyle McKinley, Elizabeth Moore, and Kathleen Umel. Next, the Outstanding Writer Award is awarded to students who receive a 95% or greater in their contemporary public health course, qualitative methods, and program planning courses. The recipients of the Outstanding Writer Award are Allison Allardyce, and Jasmine Betka. Our next set of awards honors the history of the MPH program. The first of these awards is the Helen Ross Award for her love of community health education. The first Helen Ross Award was presented in 2000 in honor of the MPH program's co-founders and former chair of what was then the Health Science Department. Helen's vision of practice-oriented, student-centered, nationally relevant professional education led to our MPH program in 1970, and shortly thereafter, a full department based on the principles of community and inclusion, leadership, compassion, and social justice, the joy of health education, and the love of life. We present the Helen Ross Award to Jasmine Betka. The next award is the Sam Rattlefinger Award for Out-of-the-Box Thinking. This award was first presented in the year 2000 in honor of the MPH program's co-founders, Sam Rattlefinger. Sam taught students to think big, to make connections between seemingly disparate concepts, to question what is, and to imagine what might be. And so we present the Sam Rattlefinger Award to Kathy Reyes Beltran. Now we move on to the MPH Service Awards. These awards are awarded to students who have taken on additional leadership positions while in the MPH program, while either serving as cohort leads, as part of the MPH Student Club, or as a member of the Convocation Planning Committee. And so the recipients of the MPH Service Award are Allison Allardyce, Estefany Ariola Ruiz, Hung Duong, Ia Gardner, Sarah Gutierrez, Sarah Hoffman, Audrey Kodama, Mirna Lopez, and Carolyn Nguyen. The next service award is for extraordinary service to the MPH program. These are students who have gone above and beyond in their service roles. So the recipients of the Extraordinary Service Award are Jasmine Betka, Alondra Hernandez, Dulce Mendoza, and Kathleen Yumo. Our next award is the Eyes on the Prize Award for students who have demonstrated an incredible amount of resilience during our program. So the recipients of the Eyes on the Prize Award are Ia Gardner, and Audrey Kodama. And our final award today is the Graduate Researcher Award. This is awarded to students who, on top of their course load and work commitments, have also worked on research projects during our program. So the recipients of the Graduate Research Award are Jasmine Betka, and Kathy Reyes Beltran. Please join us in congratulating all of our students for their accomplishments throughout the program. Now I would like to call to the stage the graduating students who will be sharing the public health commitments they all developed as a part of their leadership course this summer.
Hello, everybody. Welcome. Dulce and I will be presenting our public health commitments that we created as a class. There's 10 of them, so bear with us.
As public health leaders, we commit to ongoing critical self-reflection to recognize, accept, and analyze the impact of our lived experience on our work and on the biases we bring into the field.
We commit to eliminating health inequities in our communities.
We commit to ensuring access to health care for all.
We commit to providing culturally inclusive services to all individuals and communities.
We commit to applying systems thinking into our work to consider the impact of wider structures on communities and individuals.
We commit to achieving health justice by being accountable to those who are impacted by structural determinants.
We commit to embracing change and innovation that increase quality, impact, and efficiency.
We commit to working collaboratively with community members to build community capacity, empowerment, and self-determination about their health.
We commit to health in all policies to ensure health justice and equity and create upstream changes to prevent future ailments and build healthy communities.
And lastly, we commit to analyze social determinants of health like systemic racism and access in order to apply systems thinking to create equitable health for all.
Thank you. We will now hand it over to Dr. Ring for closing remarks.
Can I get this off? Maybe not. This is the first time I've taken my mask off in public, and I'm making sure my mustache has been trimmed. So thank you. Thank you. I just want to say it's been an honor, a privilege, and a great pleasure to get to know and work alongside you the past 2 years. Let's please give a round of applause to our 2022 cohort one more time. There are a couple of things I want to share with them. They have been 25 of the most extraordinary human beings I've had just the wonderful opportunity to work alongside with and get to know them and see their field work in action. And they've done some incredible work in the field, as they already do in their regular jobs as well, and in the communities that they serve. You are now a Master of Public Health. You have that MPH. But there are actually an acronym besides MPH that you also obtained. We start with the M. You are now a multitasking master, as you now know, right? Think about what you have done in the past 2 years. Yes, give them a round of applause. They are the masters of multitasking. They know they can do schoolwork, do internship, do their job, have families, have their life, right? You are a master of multitasking. Embrace that, appreciate that, and recognize that. For P, patience. As health educators, as you all are, you have to have a tremendous amount of patience. Because as all of our speakers have said today, there's a lot in this world that we need to address and work on and strategize, combat, right? Dismantle. But it takes patience. And you all know now you have patience because for the last 2 years, you've had to be patient with that next paper, that next quiz, that next fieldwork update that you said, do I really have to do that? I'm like, yes, you have to. It's part of your hours. But you know patience more than any other person now, especially in the field you're going to. And for H, I'm cheating a little bit on this one. You're a hard-working advocate. Give them a round of applause for that one really quick because I'm going to talk about it in a second. You all know, and your family and friends know, these are the hardest working people in the last 2 years, and they always have been, right? But now they know they are, and they know what they can do, and they know what they can achieve or succeed. But bottom line, a big part of the program, I feel, and I can only speak for myself, is that our program is all about advocacy. How do we advocate for ourselves, for our families, and for the communities that we serve, and also communities that we may not know well, but would like to be an ally or like to support? You've realized and recognized the hardworking advocacy you have done and will continue to do for the rest of your lives. We wish the world for you. We hope the world for you. We expect the world from you. Give one more round of applause again to the 2022 MPH online cohort. Final thing, Dulce and Alondra just read off some amazing public health commitments. Embrace them. I don't say that lightly, because I'm an alumni of the MPH program of the campus. And in my first year after I graduated, I was faced with a dilemma where that commitment was being tested. And I had to realize I made a commitment to my degree, and I had to speak up in a situation that was really, really dangerous. But I did it. And so I always tell you, never take commitments lightly, because it's a lifetime of service that you're committing from this day forward. I cannot thank you enough for being part of our lives the last 2 years. We are so proud of you. Thank you so much. In a moment, the music will play, the faculty will get up and we'll walk down the aisle, and then the graduates right afterwards. Please stay in your seats until we're all exited out, and then we will have the rest of the day to celebrate. Thank you so much.